ICU nurse, I kind of created a separate video for this to tell you how important the ICU nurse is. First of all, the first thing I want to tell you that usually the ICU, the nurses ratio, nurse to patients, usually 1:1 or 1:2, and actually it can be different from state to state. We've had cases where there was some shortage in nurses and it can go up to 1:3. Again, if there is a very critically ill patients, usually it's remain at 1:1. Sometimes you don't have those critically ill patients, they're still in ICU after high risk procedure, for example. And we'll come to the different kind of patients in ICU. So that's the first thing. Sometimes your nurse dedicated for one patient, sometimes for two patients, which is the most common one, and sometimes occasionally to 3 patients. The second thing I want to mention that ICU nurses most of the time are very experienced. So if you are just starting your residency, they know more than you, believe me, in ICU. So please listen to their advice. And if you don't know something, ask them. Don't let your ego say, hey, I'm a physician, they are a nurse. No, they know a lot and they can be very helpful to you. So that's why I'm trying uppercase. Be nice to them and make them your friend, please. Make them happy, make them your friend. That can actually, it's a big asset for you. It will make your life a whole lot easier compared if they don't like you. So it's very important to be nice to them, to be humble, ask for help when you don't know, listen to their advice and take it seriously. Even if you think what they're saying is not good for the patient, nicely decline that and explain to them why is that. If I can say the ICU nurse is the most important member in the ICU team taking care of the patient, I'm not overestimating that. That's what I need to tell you in this video, and I'm gonna put a red circle. Please make them your friend, be really nice to them. They are a big asset.